Hello, thank you for joining us on the Diaspora this week. This week on the program, we shall be talking health, but from a diaspora perspective. Now, Nigeria has thousands of medical professionals all over the world practicing at the highest level. What are their contributions to the medical profession in Nigeria? What are they doing to enhance the healthcare of Nigerians and, of course, boost the health system? These are issues we shall be raising with some of the professionals that have come for the 52nd Annual General Meeting of the Nigerian Medical Association. Nigeria has thousands of medical professionals all over the world practicing at various levels, including the highest levels of medical practice. But what are their contributions back to Nigeria, and how are they connecting with the healthcare system in Nigeria? That is our focus on the Diaspora this week as we discuss healthcare from a diaspora perspective. My name is Makut Simon Macham. Now, the 52nd Annual General Meeting of the Nigerian Medical Association was held in Abuja, and many medical practitioners of Nigerian origin practicing in various parts of the world attended that summit. And so we decided to take some of them up on various issues in the Nigerian medical healthcare. And this is our focus on the program today. Now let's begin the program with the discussion we had with Nigerian diasporan doctors practicing in Canada, in the United Kingdom, the United States, and of course Germany. We started by asking them why they left Nigeria for various countries and indeed what they are doing out there. People would like to know what your background is like. Were you ever in Nigeria? Did you live? When did you leave Nigeria? Yeah. Why did you leave Nigeria as a trained medical personnel, or did you get training out there? So tell us a bit about your background.
Yes, thank you so much for that question, Mahmoud. I left Nigeria at a younger age. I went to finish my high school in Nigeria, but I actually went to college, did my pre-medical education in the US, and did my medical school and the rest of my training in the United States.
When was that?
I started in 1981. Started college. Did 4 years of what they call pre-medical school, and then 4 years of medical school, and then did my training. So despite the fact that I left at a younger age, my heart is still in Nigeria. And through that commonality, able to get in touch with other Nigerian physicians, those of us who train in the US, and those who train here who later left. We have that desire to come back and give back to the country.
I attended University of Ibadan, 1973 to 78, graduated 78, worked as a house officer in Ogun State for 1 year, and did my national service in Sokoto. That was 79 to 80. Went back to Ogun State government and worked from 1980 to 85 in Ota, Ogun State. I then went to Obafemi Awolowo University Teaching Hospital between 85 and 88 to start postgraduate training in obstetrics and gynecology. But I just felt that there was something lacking in terms of the quality of training and skills and everything, so I decided to go to the UK.
Okay. So ever since, what have you been doing in the UK? And right now, what's your specialty in medicine?
I'm a consultant gynecologist and the director of the fertility control unit at St. James's University Hospital in Leeds. I've been a consultant since August 1997 in the UK, and my specialty is obstetrics and gynecology with subspecialization in reproductive health care. Okay.
Now, having practiced in Nigeria and abroad, we sought to know whether the practitioners are keen to come back home to contribute to the healthcare development of Nigeria, particularly with the knowledge they have gathered out there. And these were the responses we got. The impression is that many Nigerians abroad are reluctant. Professionals like you are reluctant to come back home. They say things are not as good as they want them to be, or just that they're having a good time out there. Is that true?
There are lots of bottlenecks, to be honest with you, on both sides really. I've had the opportunity in the last 6 months to attend lots of meetings with my fellow diaspora colleagues. In October last year, I was in Lincolnshire, where I was with my colleagues from Germany, the United States, England, as well as Dr. Olaolo and the acting registrar of the Medical Council. And we're looking at this. There is also the issue of registration, for instance, of doctors in diaspora. You can't just come here and say, I want to come and do medical missions, for instance, because you've been out of for a while and the Medical Council takes a dim view. You have to pay license fees. And I left Nigeria 23 years ago. So that means I have to pay 23 years of medical license fees in Nigeria and also pay penalty for those 23 years. And if I'm coming to help, I'm not coming to earn an income. Why should I be paying almost 23 years plus another 23 years of penalty? So those kind of issues are there. And then just last month, my colleagues from the US came and they went to Enugu and they encountered a lot of difficulties. But we're working through the Federal Ministry Diaspora desk to sort of roll over this kind of problem so that the skills we have gained can become an asset while we come and work with our colleagues.
You know, one of the major things that excites me is when I know I'm going to come back home. Yeah? And one of the advantages I have as the president of the Nigerian Medical Association is also to be coming back home. So that's why I'm really holding out strong. I'm not the kind of person who really intend to keep my knowledge, my ideas, my education outside the country. For example, if I'm seeing a patient, you know, a German patient, all I'm thinking is, look at this is, even though, you know, during your career or when you take the oath, you don't discriminate gender or color or anything, but there's this feeling you have, I can still take care of somebody back in my country, take care of him the same way I'm taking care of this person. But why am I not doing that? Oh, because there's no infrastructure. Because maybe if I go back, I will not be able to treat that person. I don't have instrument, I don't have equipment. So these are the things that, you know, are holding us back. What we can do is to come back here, share our knowledge, you know, encourage the doctors here, and also tell the government here how to improve the healthcare system in comparison with Germany or other countries. Yeah.
Now, annually, Nigerians who can afford it spend billions of dollars going outside the country to get medical care abroad. Now, oftentimes, they end up seeing medical practitioners of Nigerian origin who are based out there. We sought to know what is the perspective of these Nigerian professionals about medical tourism, particularly with reference to how that tourism can be reversed back to Nigeria. And this was what they had to say.
We can see that as a nation we are pumping a lot of our money overseas to buy a commodity that we can easily produce here, which is healthcare. A lot of Nigerian doctors are working overseas. We get our education at a very low cost compared to what our fellow professionals pay overseas. So governments actually invested a lot in developing doctors, but unfortunately we are not keeping those doctors to work in the healthcare sector, and we're not reaping the rewards of that investment. So not only are we wasting money in that way, we are also wasting money by not developing a system where people can be treated at home and allowing people to now take valuable money. We're talking about dollars at over 360 naira or so, taking it overseas to go and spend. And majority of those who go overseas end up seeing or coming across a Nigerian to treat them and do one or two things during that process. So we getting the services that we can easily afford, that we could have easily developed here at home at a cheaper cost, at a very expensive rate. So the economics doesn't make sense, unfortunately.
But as far as Nigeria is concerned, I think the problem is that there are certain conditions that cannot be managed adequately here. One, because of lack of the skills, because of lack of equipment, and if you have your money, you can decide to go anywhere you want. The buyer pays, provide the service.
Now, what will create that kind of, how will we now reach to a point where people flock to Nigeria? Because like you said, even in the places where Nigerians are rushing to go to, others are living there to other places. So when will they come to Nigeria?
You have to have an enabling environment for that to happen, and it's going to take some time. It's not something you're going to achieve in 5 years. One, let's look at the issue of equipment. We don't manufacture anything in this country. Take ultrasound machine that you can use in any of the specialties. I remember way back 1983, I did a postgraduate course in Dublin, and on coming back, I bought a fetal stethoscope, an electronic one where mothers could listen to the heartbeat. And my clinic was just full. And yet, as of this year, we don't manufacture that in this country. Until we start manufacturing the equipment that we need for advanced medical care. And that's what China did, that's what India did. They copied the technology of the US, of Britain, gradually started manufacturing the equipment, albeit at a very low rate initially, but now China is self-sufficient. India is self-sufficient because they manufacture what they need to provide the quality of care, apart from the training of the people that will use those equipment.
Of course, that all ties down to the state of medical care in Nigeria. We sought to know what they think about the healthcare system in Nigeria and how it can be improved. This is what they told us.
I think, first of all, sometimes when I sit down, I said, it's the medical system or the educational system, which one is first? Yeah. I think they go at the same time. Yeah. You know, because without health, you know, it's a problem also for the education. So you have to educate people, and then the health standard, a little bit of what I said earlier about this infrastructure, the empowerment, you know, and the maintenance of our equipment. There's something they call medical insurance. Medical insurance, I know here we have the NHIS, yeah, but let this medical insurance be accessible to the whole nation, to the whole country. You know, no matter what you are earning, because in Europe, in other countries, they take your insurance according to your level. If you're earning 1 million, maybe they'll take 1%, and if you're earning 5,000, they'll take 1% of that. And you get the same treatment with the person earning 1 million if you go to the hospital. What I realized, you go to the hospital there, all you do is just your insurance card. They treat you, they do everything. You carry your things, you go. They only need to get in contact with the insurance.
If everybody obeys the law to start with, things will function much, much better. Where I work, you walk into a ward, you have syringes, you have drugs and everything. Nobody will take a single needle out of that clinic or hospital because, one, there is nobody to use it on outside. Nobody is going to say, oh, come and see my child at home to give injections. If you do, you will have the consequences because you'll be arraigned for stealing. So the rule of law is there. You know, if you commit an offense, you will have to answer for it. That's not the case here. And that is the bane of the root of the problems in this country at the moment. Lack of the rule of law. People just don't obey the law. People do things with impunity on the grounds that nothing is going to happen. And if you don't have that sense of retribution, if you do something wrong, then the whole place descends into chaos.
Yes, indeed, so much needs to be done to connect Nigerian medical professionals back to the needs of the medical system here in Nigeria. And of course, that takes us to our Diasporan of the Week, who is incidentally also a medical practitioner based in the United States of America. She is Dr. Isioma Okoba, who has been practicing in the United States for over 20 years, but has recently come back to Nigeria to contribute to the healthcare system in the country. Let's meet Dr. Isioma Okoba, our Diasporan of the Week.
Dr. Isioma Teresa Okoba attended the University of Benin, Edo State between September 1983 and August 1990, where she obtained Bachelor's of Medicine and Surgery degree. Shortly after her internship at the military hospital in Lagos, Dr. Okoba proceeded to the United States for further studies.
In the year 2000, I actually moved to Atlanta, Georgia, where I started a master's in public health at the Emory University in Atlanta, Georgia. And I completed that in 2002. And after that, I got admission to do my specialty program at the Emory University Family and Preventive Medicine Department. And that took 3 years. So I actually graduated as a specialist in family medicine and preventive medicine in 2005 from Emory University, Georgia. And when I finished my specialty training, I started my own practice called First Life Linear Medical Center in Atlanta, Georgia. And basically what we do there is we see everybody starting from children, from newborn, all through, we have patients through in their 90s, where we offer preventive services. And because we're primary care doctors, we're the first point of call for most of the patients in the community. And if there's need for referral to see a consultant, then we refer them to the consultants. And I also tutor and teach medical students from the Morehouse School of Medicine and also from the Emory University School of Medicine, and also from some Caribbean medical schools.
In the United States, Dr. Okoba obtained more training and also began private practice. However, her heart was continuously home, where she desired to make an impact on the lives of rural people in terms of health care.
In 2000, I was much younger, and so the motivation at the time was to first increase my knowledge. Like I said, I studied a master's in public health, and I knew also to go get a specialty training. And at that time, I don't think we offered family and preventive medicine here in Nigeria. So the motivation then was first to be able to get a better and quality education. And I was able to get that from the Emory University, which is a very renowned university in America. And after doing that, I went ahead and specialized in family and preventive medicine. And so in that whole process, that whole period of time, what I was actually seeking was knowledge and also a better life. And having had all of that, I always knew when I was leaving that I was going to come back home, because I knew I was going to gain the knowledge. Because I remember critically during one of my interviews for the Masters in Public Health, I remember telling one of my professors at the time that the purpose of getting this Masters in Public Health was actually to gain a lot of knowledge, and at the end of the day, take it back home to my home country and use it and impact my people. So at the very back of my mind, I knew no matter how long I spent in the United States of America, I was going to take all the knowledge, all the experience I learned from there. What I did was, during the time I was in Atlanta in America, I set up a foundation which is non-profit called Delta Doctors in Diaspora and Dr. Isioma Okoba Foundation. And basically what we did was, at the very early stage, would come with doctors and come with free medication and offer free medical services to the rural communities in Delta State. And so we did this for a couple of years, and during that period, I kind of found out that the people we were treating in the communities that we went to would just get medications for like 1 month, maximum 3 months. And I didn't see that there was a need. I did see there was a need for continuity of care for these patients, because we would be around for like a month and go back. And I asked myself, what happens to them in the 11 months of the rest of the 12 months in a year? And that inspired me to set up, or actually build a community health center in my community in Nibodo, which is in Delta State. And so at the time, when I built this community hospital in Ibudu, my community didn't have a medical doctor. And so what I did was, after building it, I put a Nigerian medical doctor there and the nurses, and actually would pay from the foundation and pay their salary to keep the place running, which I can still tell you is still running and very effective. And what I would do was bring medications from America and supply the hospital. So whenever we come for the medical missions, we would tell them, when you run out of your medicines, especially medicines for high blood pressure, diabetes, those kind of continuous medications that you have to be on, you can actually access more by going to the Dr. Isioma Okoba Foundation Medical Center in Ibudu and get free medical consultation and get free medications. So those were the things I did in the years I was away, helping me connect with my people, offer them free medication, free medical consultation. And that really helped a great deal, because it helped us really realize where there were gaps and what we needed to fill to help improve the healthcare of people in the rural community, which is my area of specialty.
Her modest contribution to the people over the years did not go unnoticed, as she was appointed in 2017 as chairman of the Delta State Primary Healthcare Development Agency and executive assistant to Delta State Governor on e-health.
First of all, I'm very, very grateful to the Executive Governor of Delta State, Senator Dr. Ifeanyi Okowa, because for me, my job currently, I love my job. It's something I'm passionate about. Like I said, over a decade, I have been coming to the rural communities in Delta State and offering free medical treatment, consultation, and having to, interact with the people in the rural communities. So actually giving me this appointment I am very grateful, because it's really helping me to impact on the knowledge that I have and see how we can drive the primary health care in Delta State. Having been able to come over the years and still be in touch with the people was very helpful, and that helped me stay connected. And so that challenge of just coming, if I hadn't been here in a long time, or having been interacting with the people for a long time, may have been a challenge. But so I didn't experience that, because I was already in tune with the people here. And but for my colleagues in the diaspora, I know a lot of them want to come back, and so it will be helpful to really encourage those, because a lot of Nigerians out there, all the consultants, you name it, they're out there, Nigerians leading the field of any specialty in Canada, United States of America, England, anywhere, just name it. We have Nigerian diasporas, and so we should have a way we can actually attract them to come back with their knowledge, because they have wealth of knowledge.
Kudos to Dr. Isioma Okoba, who has remained connected with her motherland and indeed contributing to making the healthcare system better. Kudos to you again. Now is that time when we bring you some diaspora news as we look at what is happening with Nigerians around the world. Diaspora news is next on the program.
Bridging the education gap in Nigeria, a panacea for economic development and national security, is the focus of Zumunta Association, a body of Nigerians of northern origin in the United States of America, as they prepare for their 2018 International Annual Convention, scheduled for Columbia, Missouri. A statement by the body says the theme was chosen in order to find how the diaspora can contribute to solving the educational, economic and security challenges of the region and Nigeria at large. Similarly, the 17th Nigerians in Diaspora Organization Annual General Meeting and Convention is scheduled to hold in Virginia, the United States of America, in August this year. The convention, according to a statement, wants to discuss the contributions of diaspora Nigerians to the American fabric. Members from across the Americas and the Caribbean, as well as dignitaries from Nigeria, are expected to attend. And finally, the Consul General of Nigeria in Shanghai, China, Anderson Madubike, has commended Nigerians in the province for their hard work and obedience to the laws of the land. Madubike, who took a tour of the city, met with Nigerian students at the Zhejiang University of Science and Technology as well as Tongji University.
And Diaspora News brings us to the end of the program this week. Thank you very much for sharing your time with us. We hope you join us next time for another edition. On behalf of the rest of the team, my name is Makud Simon Macham. Thank you for watching.